Good morning, everyone. I'm Marathe. I'm an ID doc. And a big thank you to CTSI for the invitation. And I'm truly honored to be sharing the same stage as my esteemed colleagues who have done such fantastic work in the field of community engagement. My focus today is on Boston COVID recovery cohort, which is part of the National Recover Initiative. And I'm going to focus specifically on engaging communities to advance the understanding and management of long COVID. I don't have any disclosures. So the objectives of my talk today are to provide an overview of the Recover study, to discuss the role of the National Community Engagement Group, and then the bulk of the talk is to focus on the BCRC and its commitment to building trust for community partnerships and education. So the Recover Initiative is a really large $1 billion worth of NIH initiative. In December of 2020, Congress appropriated $1.15 billion to the NIH to study long-term effects of COVID-19, including long COVID. In accordance with the plan of how this study needed to progress, the Recover Initiative was created in February 2021, and the funds were allocated through the American Rescue Plan. Recover awards were made to more than 30 groups, and that includes hundreds of sites across the US. So BCRC is our Boston hub and comprises of 6 distinct institutions that we'll go over. The goal of Recover is to rapidly improve our understanding of post-acute sequelae of COVID-19 or PASC. The study nationally enrolled both infected and uninfected individuals. The enrollment is still ongoing. We are close to completion in the adult cohort, but as of October 13th, in the adult cohort, there were 12,510 participants. In the pregnant adult cohort, there were 2,062. And in the pediatric cohort, 12,256. So you can see that this is a beast, right? Now, long COVID was a term that was coined by the patients who continue to experience symptoms even after recovery from COVID-19. So it's a brand new disease that was first described in May of 2020. And community engagement and participation needed to be at the core of everything that Recover did. So even at the national level, they created a national community engagement group that comprises of over 70 patients, caregivers, and community representatives. They participate at all levels of leadership and even on an individual level when questions arise that may be site-specific. Their goal is to contextualize and provide insight into the reality of living with the symptoms, diagnosis, and treatment of long COVID. The goal of this national engagement group is also to incorporate patient and community perspective in discussions, as well as decisions about how to prioritize, structure, and disseminate the research, and to bring to the surface any concerns that they might have. So what is BCRC? Like I mentioned, it is our hub. It's the Boston hub. It has 6 sites. So Brigham, Mass General, Beth Israel, Cambridge Health Alliance, Tufts, and Boston Medical Center. All of these sites together supported the creation of a community partnership table. And the goal of the community partnership table was to bring together community members, researchers, and the leaders from these 6 health systems to transform and support issues that came about for COVID-19 health equity, with the ultimate goal that the disparities that were highlighted during the pandemic we could address them proactively and eventually transform them into health equity. The first steps of the community partnership was to connect a large group of underserved or underrepresented individuals across Boston that included Black and Latino populations, people who were unhoused or had transient housing, people with disabilities, new immigrants to the US, as well as patients who were older or identified as LGBT. The graph, as you can see, at the center, you have the 6 institutions and the partnerships that were formed or pre-existing with our community-based organizations that helped us recruit a diverse group of population. So at the very top is BMC, and we partnered with 2 of our sister community health organizations, so Greater Roslindale, as well as East Boston. And a new partnership that we created was to reach out to Boston Healthcare for the Homeless, because we had such a large difficulty in recruiting from that specific group and keeping them retained for the study. When you look at patient demographics, I like to think that I'm privileged to serve at an institution whose motto and mission I truly value. And that's reflected in how we did with our recruitment as well. So across BCRC as well as BMC, the large group that we recruited were women, so over 60%. When it came to race and ethnicity, BCRC as a whole recruited about 65% white non-Hispanic individuals, whereas at BMC, we had 50% white non-Hispanic, 25.5% Black or African-American non-Hispanic, and around 10% Hispanic or Latino. When you further looked at the breakdown of education status for those who had college education versus not, you can see that across BCRC, 26.1% had no college education. At BMC, we were double that. So 41% did not have college education. But when you focused on the non-white group of our participants, actually 78.6% reported no college education. BMC did enroll the highest percentage of BIPOC community members. MGH, on the other hand, recruited the largest percentage of Hispanic or Latino individuals. They also partnered with La Colaborativa, which helped make their enrollment more robust. Also across BCRC, all sites did really well in recruiting members who reported at least one disability or identified as belonging to the LGB group. The gender identification data was not available yet. What else did the community partnership table do? So we also created an education forum series with input from the community members to actually figure out what was it that people wanted to hear about. And the goal is to create a learning community that will come together monthly to better understand long COVID. And it's actually open to public. The series does encompass talks from multiple disciplines, allows for people to share their lived experiences and come together as a group to brainstorm next steps. So as an example, the talk last month was Healing from Loss and Grief of COVID and Racism, the Power of Community Building and Belonging to Foster Resilience and Advance Health Equity. And you can see the diverse group of speakers that were available to the community members to have an open dialogue with. So you had John Powell from Berkeley, so UC Berkeley, our own Dr. Gloria Hammond, Linda Sprague Martinez, who until recently was a BU faculty member, as well as a member of the community who's living with long COVID, Ms. Netia McRae. An upcoming talk that's actually going to be today is now to address policy priorities to address long COVID in our country. and advance health equity in our state. So all of these topics are chosen by the community members, and the speakers, it is solicited to provide feedback on what members want to hear about. We have a pretty large community engagement team. And as you can see, Tracy Battaglia, who just gave a wonderful talk right before me, is our lead on the partnership table, along with Hope White, who's also a member of the Community Engagement Alliance. What are the lessons learned? I'm sorry, this is a busy slide, but the takeaway is that patient representatives are important in all aspects of representation. The one thing we did learn as BCRC, which is the second point, is that there was a mismatch in when we started recruitment and when the partnership table was formed. And so within Boston, the feeling was that community members were not heard and were not able to provide input into the study design and the rollout. So we had to take a step back, take additional steps to rebuild that trust, and then say, what can we do better? And one of the ways we thought we could help our community was through the education forum series. And that's what we ended up doing. And to basically guide them through this journey of understanding. As a medical community, we are learning about it along with our patients. So this has been incredible for us. And with that, thank you so very much.